Hello everyone. Today we will discuss about the Norma Lateralis view of the skull bone. Now first of all, this is the Norma Lateralis view, the side view of the skull. Now these many bones actually forms the Norma Lateralis. First of all, the frontal bone, the occipital bone, then this yellow bone, this one is the sphenoidal bone, the butterfly shaped bone. Then the maxillary bone, this is the maxillary bone. This is the nasal bone, the dark purple part is the nasal bone and this light purple is the maxillary bone. Then the mandibular bone, then this zygomatic bone, or we can say the malar bone or the cheek bone, then the temporal bone and the parietal bone. Okay, these many bones actually forms the Norma Lateralis. Now the features of the Norma Lateralis: temporal lines, zygoma or zygomatic arch, external acoustic meatus, mastoid and the STYLOID process, and three fossas: temporal, infratemporal and the pterygopalatine fossa. So we'll talk about all these features individually. First of all, temporal lines. Now this is the temporal line. First of all, let me tell you some of the features, some of the things in this. First of all, this is the external acoustic meatus. The opening of your ear is the external acoustic meatus. Right, now about this is the zygomatic arch. This is the zygoma or the zygomatic arch. We'll talk about this further in this video only. This is the zygomatic arch or the zygomatic. This is zygomatic arch or zygoma. Now from here, this is your face part. Right, over here will be your main face, and this is your occipital part. So just imagine what I'm saying. Okay, this is the facial part, and this is your occipital or the back part of your skull. So this is the external acoustic meatus, this is zygoma. And above this external acoustic meatus, we have one suprameatal triangle. Because it is superior to the external acoustic meatus. So as the name says, suprameatal triangle, superior to the meatus. This triangle, it is visible, right? Suprameatal triangle. And over here somewhere will be the supramastoid crest. And remember, this is the mastoid process. We'll talk about this. Okay, so this supramedial triangle, this supramastoid crest. Now, temporal lines. First of all, this is a temporal line. Okay, the temporal line begins from the zygomatic process of the frontal bone, then goes upwards. Okay, crosses the frontal bone, the coronary suture, and then divides into two main lines: superior temporal line and inferior temporal line. The superior temporal line will fade away at the back side, but the infratemporal line actually is visible and will go backward, then backward, downward, and then forward, and will end and will also cross the supramastoid crest. It will cross the supramastoid crest. Okay, cross supramastoid crest, and then actually ends at the posterior root of the zygomatic arch. This is the zygomatic arch. So it has mainly two roots, posterior root and the anterior root. Okay, we'll talk about the roots in further in this video only. So just remember right now, it will go back, cross the supramastoid crest, and ends at the posterior root of the zygoma or zygomatic arch. Now the zygomatic arch or the zygoma. First of all, this is the zygomatic arch or the zygoma. It is mainly formed by the two bones. This is the zygomatic bone and this is the temporal bone. So it is formed by the temporal process of the zygomatic bone in its anterior 1/3, and the posterior 2/3 is formed by the zygomatic process of the temporal bone. Okay, and it is mainly present. It is actually a horizontal bar on the side of the head in front of the external of your external ear. Okay, somewhere over here will be your this is your external acoustic meatus. Okay, so it is mainly present in front of your this ear, side of your skull, and little above the tragus. Okay, you may know what is tragus, the little projection of a cartilage. Okay, it is mainly visible from outside as well. So it is present in above the tragus. Okay, and formed by two main bones. The zygomatico-temporal suture. This is zygomatico-temporal suture actually unites these two bones together. Now above the zygomatic arch, there will be temporal fossa, which is filled by the temporalis muscle, as the name says, and attached to the lower margin of this is the lower margin of the zygomatic arch or zygoma, where the masseter muscle, the main muscle for mastication process, will be attached. Now the contraction of these two muscles, temporal muscle and the masseter muscle, can be felt when you clench your teeth. Now the arch is actually separated from the side of the skull, this arch, by a small gap in front and behind. Okay, so over here will be gap. And now very main important word, jugal point. Jugal point is nothing but the anterior end of the upper border is known as jugal point. Anterior, and this is the zygomatic arch. So anterior point of the upper border is a jugal point, and the posterior end of the zygomatic arch is attached to the squamous temporal bone by two main roots, anterior root and the posterior root. Okay, this is the posterior root which actually is in contact with the that inferior temporal line. We discuss about this, and the anterior root. Now remember that the anterior root is actually lies in medial to the mandibular fossa of the temporal bone. Okay, mandibular fossa actually, or we can say the glenoid fossa or the articular fossa, actually that fossa of the temporal bone that actually attaches with the this mandible to form the this temporomandibular joint, or we can say the it is very important when we talk about in the further videos. So that mandibular fossa, okay, so it is this, and this anterior root is actually medial to the glenoid fossa, and the posterior root actually lateral to the glenoidal fossa or the mandibular fossa. Now over here, as you can see this, you can see this this part, a tubercle type thing, is the articular tubercle of the zygomatic arch. Okay, this is the articular tubercle. Now remember, two projections are mainly visible in the relation of these two roots. Now this root, this articular tubercle, is present at mainly the junction between the posterior root and the anterior root, and there is one more tubercle that known as the post-glenoid tubercle. As the name says, post-glenoid, that means of course it is actually present just behind the articular fossa or the mandibular fossa or the glenoidal fossa. Okay, and that is known as the post-glenoid tubercle. Now next is the external acoustic meatus. I told you before what is it. This is the external acoustic meatus of yours, and this is the, just remember, this is the zygomatic arch, posterior root, anterior root. This is the tubercle, articular tubercle, and over here will be your face, and over here your occipital part or occipital bone of yours, the posterior part. This is the mastoid bone. Now over here I told you before that this is the external acoustic meatus. Above this we will be having the suprameatal triangle. This is a suprameatal triangle, close view. Okay, this is the suprameatal triangle, and over here somewhere will be your supramastoid crest. Okay, over here somewhere, where actually the inferior temporal line will be continued and will end at the posterior root, right? Now over here we are having one spine also known as the suprameatal spine. Now this external acoustic meatus, first of all we talk about this. External acoustic meatus open just below the posterior part of the posterior root of the zygomatic arch. This is the posterior root, so just below that over here. Okay, now first of all it is margins, right? You can see. So first of all it's anterior margin, inferior margin, and the postero-inferior margin. This portion, anterior, inferior, and the postero-inferior, these whole margins are actually formed by the tympanic plate, and the postero-superior margin, this portion, posterior-superior, is formed by the squamous temporal bone. So this one by tympanic plate, and this one by the squamous temporal bone. The margins are actually roughened for the attachment of the auricular cartilage. Now the suprameatal triangle, this one, this is also known as the triangle of the Maceven, M-A-C-E-V-A-N, whatever you pronounce. Triangle of Maceven, suprameatal triangle, is a small depression postero-superiorly to the meatus. Okay, as it is visible in the diagram only, and it is bounded above by the supramastoid crest, in front by the posterior-superior margin of the external acoustic meatus, and behind by a vertical tangent to the posterior margin of the meatus. Now the suprameatal spine, this is the suprameatal spine, you can see somewhere over here, spine type. may be present on the anteroinferior margin of the triangle. Okay, present at the anteroinferior margin of the triangle. This is the triangle, and the anteroinferior margin is suprameatal spine. The triangle from the lateral wall of the tympanic or the mastoid antrum. Okay, now the measured part of the temporal bone. Now the measured part of temporal bone lies just behind the external acoustic meatus. This is the measured process of temporal bone. Now the measured temporal bone articulates posterior-superiorly, of course, posterior-superiorly with the parietal bone by the parieto-mastoid suture, and posteriorly by the occipital bone by occipito-mastoid suture. Over here it is not visible, but by the it actually can do the parietal bone by parieto-mastoid suture, and by occipital bone by the occipito-mastoid suture. And now the parieto-mastoid suture and the occipito-mastoid suture actually meet with the lambdoid suture. Okay, lambdoid suture, I told you before, it is actually present at the in between the occipital bone and the parietal bones, right? So that occipito-mastoid suture and the parieto-mastoid suture will actually connect with the lambdoid suture. Okay, and that meeting point, particular point is known as the asterion, and it is also known as the posterolateral or the mastoid fontanelle also. Okay, just remember, it is also known as the posterolateral fontanelle. We discussed about the anterior fontanelle and the posterior fontanelle in our Norma Verticalis video. The anterior fontanelle, or known as the bregma. Okay, it is also a fontanelle, and the posterior fontanelle actually lambda. Okay, where this sagittal suture and both the lambdoid suture actually meets. Okay, so they also have the particular time where they close. So over here the asterion is the posterolateral fontanelle across around 12th month. Now this mastoid process over here, it is present just behind the external acoustic meatus and appears during the second year of life. Okay, now we have two more over here things. There is a tympanomastoid fissure. Okay, it is present at the over here somewhere. This is your external acoustic meatus. Okay, and this is the base of the mastoid process. So it is mainly present, the tympanomastoid fissure is placed on the anterior aspect of the base of the mastoid process. Okay, you can feel from outside as well. Okay, from your just put your fingers at the base of a mastoid process. Okay, and you will feel one fissure over there. There is a tympanomastoid fissure. And one more thing, mastoid foramen. Mastoid foramen lies at or near the occipito-mastoid suture. Somewhere over here will be your occipito-mastoid suture. Okay, and over here this is your mastoid foramen. This is a mastoid foramen. Okay, present just in front of the occipito-mastoid fissure. We'll talk about what things pass through the foramen of all in the Norma Lateralis at the end of this video. So this is the mastoid process. Over here this is the mastoid foramen. This is the standard process. It's a needle-like thin long projection from the temporal bone seen in the Norma basalis view only. We will discuss about Norma basalis view of the skull in our next video. So it is actually arises from the temporal bone. This is needle shaped. Okay, and it is situated anteromedially to the mastoid process. This is your external acoustic meatus. So anteromedially, this is the mastoid process. So anteromedially to this is the standard process over here. It is directed downward, forward, and of course medially, slightly medially, as you can see. Okay, its base, it has one base and one apex. So its base is partly ensheathed by the tympanic plate, while its apex over here or the tip is usually hidden from view by the posterior border of the ramus of the mandible. So this is the standard process, anteromedial to the mastoid process. Now we have mainly three fossas: temporal fossa, infratemporal fossa, and the pterygopalatine fossa. We will talk about all these fossa in our particular next videos. Okay, in the further video we will talk about the individual fossas because it is a very huge topic. We can cover every topic in a particular video. Now the muscle attachment of the Norma Lateralis. First of all, temporal fascia. The temporal fascia is mainly attached to the superior temporal line, and to the area between the two temporal lines. Means attached from this area, and inferiorly it is attached to the outer outer lip and the inner lip of the upper border of the zygomatic arch. So from this to this there is temporal fascia. Now temporalis muscle origin arises from the whole part of the temporal fossa except the part formed by the zygomatic bone, and beneath the muscle there are mainly deep temporal nerve and vessels. And the middle temporal nerves and vessels produce the vascular marking on the temporal bone just above the external acoustic meatus. So may just remember the deep temporal nerve and vessels are present beneath the muscle. So we can say that the space between the temporal this temporal fossa and the zygomatic arch, of course over here will be a space. Just imagine the space in between these two. So from there mainly passes three things, that is the temporal tendon, temporalis muscle tendon, deep temporal nerves and deep temporal vessels, veins and arteries. Okay, now the masseter muscle, the medial surface of the lower border of the zygomatic arch. I told you before also, lower border masseter muscle. Okay, now the lateral ligament of TM joint. Okay, this is the articular tubercle. So from this lateral ligament of temporomandibular joint arises, lateral ligament of TM joint, temporomandibular joint. Now the three muscles, sternocleidomastoid, splanus capitatus and the longissimus capitatus are insertion. Okay, till now we were studying the origin, but this three muscle insertion actually occurs from the before backward in a series. Before backward in a series from the lateral surface of the mastoid process. And also remember the posterior belly of digastric, okay, also arises from the mastoid notch. And the groove obliquely placed behind the mastoid notch. Okay, there is a groove. Okay, just very slight groove behind the mastoid process. So behind the mastoid notch there is a groove. It is made due to the presence of the occipital artery in that groove. So behind the mastoid notch, in the mastoid notch, the attachment of the posterior belly of digastric, and behind this notch there is a groove for the occipital artery accommodation. Now the gap between these two I told you before only, tendon, temporalis tendon, deep temporal nerves and vessels. Now next are the structure passing through the foramens. Okay, in this just remember I told you before also there is tympanomastoid fissure. Okay, where it is present. It is present at the anterior aspect of the base of the mastoid process, somewhere over here. This is a mastoid process, somewhere over here will be tympanomastoid fissure, and it passes mainly the auricular branch of the vagus nerve. Now the mastoid foramen is present in the mastoid process over here somewhere in front of the occipito-mastoid suture. Here somewhere will be the mastoid foramen, passes mainly two things, emissary vein and the meningeal branch of the occipital artery. Okay, meningeal branch of the occipital artery. Now this emissary vein connects the sigmoid sinus to the posterior auricular vein. Now next is the zygomatico-temporal foramen. This is zygomatico-temporal foramen. It mainly passes the nerve of the same name and one minor artery. Now one more important thing, don't get confused between the zygomatico-temporal foramen and the zygomatico-facial foramen. Zygomatico-temporal foramen comes in the relation of the Norma Lateralis, where zygomatico-facial foramen is somewhere over here, as you can see, and it mainly comes in the relation of the Norma frontalis part, not the Norma lateralis. In the Norma lateralis there will be zygomatico-temporal, and Norma frontalis zygomatico-facial. Now the zygomatico-facial foramen mainly passes two things, nerve of the same name, zygomatico-facial nerve, and a branch of the maxillary nerve. Now the clinical aspect of this Norma lateralis is that now there is a terion site. What is terion? Terion is the union, or we can say the meeting point. Actually terion is a point of the meeting of mainly four bones. Remember, frontal bone, sphenoidal bone, temporal bone and parietal bone. So these four bones meet at a point, and that is known as the terion, also known as the anterolateral fontanelle. It is a very thin part of the skull, and mainly in the roadside accidents, what happens is the anterior division of the middle meningeal artery is present at this area. Anterior division of the middle meningeal artery, a branch of the maxillary artery. Middle meningeal artery is a branch of maxillary artery, is present at this area, and it may rupture and cause severe bleeding, and also can cause clot formation. Because of the clot formation, it will cause compression on the brain, and cause paralysis of the motor part of the motor side of the opposite side of the injured part. Okay, suppose the right side is actually injured, so it will cause paralysis of the left side. Now this clot must be sucked out at the earliest by trephining, and the head must be protected every time while driving two-wheelers by using a helmet. So this was all about the Norma Lateralis side of the skull. Hope you understood it well. Thank you so much.